Okay, dear colleagues, I would like to present my topic, what hides behind the rosacea, ophthalmologist's point of view. Rosacea is a common chronic inflammatory skin disorder with multifactorial causes characterized by redness, inflammatory papules and plaques, telangiectasis, and edema on the mid-facial region.
So if you excuse me, just for all speakers, they need to introduce themselves and their country and the presentation.
Okay, so let's do it from the beginning. Good morning, colleagues. My name is Pavliv Sofia, and I am from Lviv, Ukraine. It's the western part of Ukraine. And my topic is what hides behind the rosacea, ophthalmologist, our point of view. And let's proceed. The disease is also known to have relapsing and remitting periods. Trigger factors can include exposure to heat, spicy foods, or ultraviolet radiation. Rosacea has been classified into 4 subtypes. One of them is ocular rosacea. According to the previous studies in the literature, the incidence of ocular involvement in rosacea is from 6 to 72%. It often includes meibomian gland dysfunction, chronic conjunctivitis, and recurrent lesions, telangiectatic margin part of eyelids, blepharitis, keratitis, and scleritis. On the picture, you can see the acute meibomian gland dysfunction in the young patient with rosacea. Some authors revealed a significantly higher activity of matrix metalloproteinase 9, which is produced by the corneal endothelium in the tear film of patient with rosacea. Also, there is a higher concentration of collagenase 2 in the tear film in patients, which indicates an increase in inflammatory activity. Co-authors determined that the inflammation of ocular surface changes biomechanics of the cornea. The resistant coefficient is much lower than in healthy individuals, as well as in keratoconus. And the clinical case, male 66 years old, came with complaints on red eyes, itchiness, recurrent lesions, increased lacrimation, the feeling of discomfort in both eyes. Symptoms become worse after drinking alcohol and hot drinks. Also, he had a cyst on the left eye. Sometimes blurred vision in all distances that becomes better after frequent blinking. Previously, he was treated with different kinds of drops and ointments, but did not get any long-time results. For reading, he uses glasses. In the slit lamp examination, we found that eyelids had moderate redness. During palpation, there were several induration with no pain feelings. Margin part of eyelids, telangiectasis, obstructed meibomian glands, redness. Conjunctiva with folds of conjunctiva in the lower temporal quadrant. Pronounced vascular network. On the cornea, you can see on the picture that there is a vascularization along the limbal edge. Anterior chamber lens eye fundus without abnormal changes. Here you can see the results of the EDO examination and the diagnosis of ophthalmorosacea or ocular rosacea in the stage of exacerbation, recurrent lesions, chronic blepharitis, dry eye disease, meibomian gland dysfunction, presbyopia on both eyes, undefined tumor on lower eyelid on the left eye. The recommended treatment he received, dexamethasone monodoses, azithromycin to stop the metalloproteinases, artificial eye drops with trehalose, and cyclosporin. It is recommended to use all the eye drops without preservatives. He used the eyelid hygiene with wipes, tablets of doxycycline hydrochloride. 2 weeks after the beginning of the treatment, we removed surgically the cyst on the lower eyelid. And 8 weeks after the ending of tablets doxycycline hydrochloride, we started IPL therapy. It is important to start 8 weeks even more after the end of doxycycline because of photosensitization of the skin. IPL therapy we use to ease the expression of meibomian glands, coagulate the abnormal vessels, and reduce the inflammation around the treated area. Increase in collagen synthesis, circulation of immune-glanting cells, renewal of meibomian glands, reduction in inflammation on tissues. Also, we eradicate the demodex with IPL. On the video, you can see 2 types of IPL. The first one we use with eye shields when we have a lot of lesions on the eyelids. The second one is the classic with the protective glasses. First results of the treatment after the eye drops, tablets, IPL therapy, reduction in the number of telangiectasias on the face and eyelids, improvement in the condition of the tear film, reduction in the number and size of lesions in the eyelids. The treatment is still in progress. And the conclusions with patients with rosacea is that detailed analysis is always the key to the problem solving. Examination not only of the eyes but also of the whole face. If you have children, it is important to examine photo of parents or close relatives and to use all the all the ways we have to treat rosacea, skin disorders, and blepharitis. Thank you for your attention.